Is Aspire UK-based? Yes, we are UK-based company and we have got our academy in the UK. It's near Manchester in Blackpool. Yeah, we are UK-based company. Yes. Right. So keep putting your questions in the chat box. Yeah. Will this be available to rewatch again? Yes, I'm trying to record it. Yes. So hopefully, yes, it will be available for you to see that as well. With a full-time job, how much time is in one should be attend the offline course? See, my recommendation is you can attend the offline course. Online course. Offline, what do you mean by that? So I would say it is so what we do, we live telecast. So you can attend those online courses, online live telecast. It's not recorded, I'm saying live. So you can attend those. If you're working, what you can do in the first batch, maybe you can attend 3-4 days. You miss rest of it. In the next batch, you can attend those 3-4 days. And the next batch, you can attend next 3-4 days. So you can do that way as well. It's not like you have to do all 12 days in one go. You can just break it down and attend it accordingly. Plus, we have got the recorded course as well. That also we're going to give it to you. So you can mix it up and then practice accordingly. And then when you come to the academy, you are able to attend in-person classes as well. So that is how it is done. We have premises in London rather than Blackpool. We are based in Blackpool, doctor, only Blackpool. Would it be possible to stay in London for the course or would that be too much time consuming? I mean, you can stay in London because we live telecast our courses, but then I would always recommend to attend in person. So, I mean, instead of staying in London, if you can stay in Blackpool, that would be much, much better. All right, so let's begin. Let's begin. Keep putting your questions and I will answer the questions later. Is it only 12 days? The course is 12 days, doctor, but then the practice session keeps on happening. Post-course support session happen. A lot of things happens actually, and I'm going to explain that in detail. All right, so let's begin. PLAB 2. So as I mentioned, so congratulations, first of all, those who got their PLAB 1 result, those who are successful. Yeah, and you did it. Yeah, first step is done. So in Aspire Academy, I'll say these two are the main tutors, myself, Ankur Garg, and Dr. Nikhilesh. So you'll find like most of the classes are taken by the main tutors. For example, I teach medicine, I teach ethics, I teach some of the examinations. And then Dr. Nikhil, he teaches counseling, he teaches Sinman, he teaches prescription and some of the examination mannequin. So the main classes are taken by the main tutors and we've been doing it for last 8 years. All right. The offline session happens in what days? I'm going to tell you, doctor. So it's a 12 days course and then we have like a gap of 8 days and then again we have got that course happening. What if I take subscription now and it expires before I join the academy? It will not expire, doctor. It is going to be there till you pass your exam. So it's not going to expire. Don't worry about that. Okay. So let's begin. As I said, I want to make sure this session is actually helpful and you learn something from us and you see how Aspire teaches, right? So we're going to show you guys if you like it or you don't like it. That's the main thing. Yeah. And when we pick the date of the batches, is that in person or online? It's up to you, doctor. So when you pick it, it's up to you. You can attend it online. So what is gonna happen? You will get the link for online. And if you want to attend it in person, you can email us that I'm gonna come in person. So that is absolutely fine. Have your candidates been passing their exams? Of course, doctor. That's why we are doing the course, isn't it? And we are proud to say we are the only academy doing the live sessions, right? Only academy. You can search, you can do your research. And we're proudly saying we are the only academy, no academy doing live sessions. We are doing the 12 days live sessions. So nobody is doing it, right? So yeah. Now, as I said, we wanted to make this session productive. So let's do the introduction part. So this exam, this is an OSCE exam, right? This is an OSCE exam. And all your questions, Dr. Ali, just put your question. I'm not sure if I have missed your question. When should we book our exam? Book an exam as soon as possible. That's the thing. As I said, you should have 2 to 2.5 months, right? So, for example, now we're in September. So anything like late November or December or January, you can book it if the dates are available, right? I'm going to answer all these questions. Let's begin. Let's begin. So in this exam, what happened is you'll have 16 stations, and these stations are from all the departments. You'll have from medicine, from surgery, gynecology, pediatrics, psychiatry, some counseling station, ethical station, examinations, mannequin, simman, prescription, lot of things you will see. So all things are going to be there in your exam. Each station is going to be of 8 minutes. Each station is going to last 8 minutes, right? So you'll have 16 patients, 8 minutes each. And when you're standing outside the cubicle before you're gonna go in, right? So what's gonna happen? So you'll get 1 minute and 30 seconds to read that task. You'll get 1 minute and 30 seconds to read that task. And then there will be a bell will say begin. And you go in the cubicle. In the cubicle, you'll have 8 minutes with your patient. So this is how it works. So in total, you can say one station is going to take 9 minutes and 30 seconds. Right. And you have to talk continuously. So what happens is that you'll be having 2 rest stations as well. So you have 16 station plus 2 rest stations. Right. So this is how it works. So in total, we'll have 18 stations. 16, you have doing the station, 2 is the rest station. So the exam is going to take roughly 3 hours. It's not easy to talk for 3 hours, guys. So you have to make sure you prepare accordingly. It's not easy to talk for 3 hours with full concentration, right? And your patients, they are not real patients, they are professional actors. They are professional actors, right? Is everything in the course taught according to the NICE guidelines? Yes, we follow 3 main resources, doctor. So NICE guidelines, sometimes what happens is they're quite extensive and your patient might not be needing that much of information. So we follow NHS websites, we follow patient.info, and we follow NICE CKS guidelines. These are the 3 main resources that I would like you guys to follow as well when you are preparing for your PLAB-2 exam. And a lot of when you are in your respective countries, you may not be able to open the NICE guidelines, isn't it? Because of the UK strict protocols and all. So then, meanwhile, you can have a look at NHS websites, you can have a look at patient.info as well. So that should be fine as well. But yes, our course is being taught based on these 3 resources. Yeah. So, as I said, the type of consultation you have: history, counseling, ethics, examination, simman, prescription, and you may have 1 to 2 teleconsultations as well. After COVID, when they started the exam, there were too many video consultations that were happening, but nowadays, not many. So you'll see 1 to 2 teleconsultations as well in the exam. So what happens in the teleconsultation? So you'll not have the patient in front of you; they are just on the phone itself. So that's how it works. Yeah. Okay. So when you get the result, this is how the results is gonna look like. So every single station gonna be divided into 3 main things. One is data gathering. Data gathering is your history taking skills. Then your management, how you're managing the patient and how you're talking to the patient, interpersonal skills. These are the 3 domains, and each domain maximum score is 4. Maximum score is 4. So you can say each station is going to be of 12 marks. So each station is of 12 marks. So they will tell you the details in the result, like station 1, you got 4 in data gathering, you got 1 in management, you got 4 in interpersonal skills. So the detailed results will be given it to you. And they will tell you what's your total score and pass score needed to pass that particular station. Now, what do you think out of 12, how much marks if we get, we can pass that station? Nowadays, instead of giving the marks in points, they have made sure the pass score is kind of 6. So 6 is kind of the passing score. So if you get 50% of marks, you pass that particular station. I'm not saying you pass the exam. To pass this exam, what are the criteria that you need to follow? So there are 2 criteria that you need to follow to pass this exam. Number 1, you need to get above the average score. You need to get above the average score. Now, you might be thinking, what is the average score? So average score is going to be different on different days. However, nowadays what's happening, every station passing score is 6. So it's not going to be more than 96. So nowadays what we have seen is the average score is coming 96. So as long as you are able to get more than 96 or around 100 marks, you'll be able to clear this first criteria. Second criteria is you need to pass certain number of stations as well. Now, the question comes, how many stations I need to pass this exam? So, the number of stations used to be 10 out of 16 till November 2024. And now they have actually made some changes in it. They said how many stations you need to pass, they will be deciding on that particular day, right? So in one exam, the number of stations you need to pass might be 9, another day it might be 10, another day it might be 11 as well. So that will also be decided on that particular day. Now, is it good for us? Is it bad for us? To be honest, I would say it is actually good for us. Why I say that? Now I have seen a lot of candidates, those are passing 9 station, they're also passing the exam. All right. So before that, what used to happen, you need to pass 10. So if somebody is passing 9, they used to fail the exam. But now we have seen this results system, this marking criteria is actually better. So I've seen many candidates getting only 9 station and they're getting above the average score and still passing the exam. So this is, I mean, how it works. Okay. So you get another sheet as well. So this is your another sheet, like they're marking us on 10 skill areas. They're marking our consultation skills, our diagnosis, examination, findings, issue, language, listening, management, rapport, and time. So they are actually checking these 10 skill areas. The marks are given into 3 things: data gathering, management, and IPS, interpersonal skills. And they're marking us on these 10 skill areas. So let's find out what exactly they are expecting from us. So this is, we have taken from the GMC websites. So in the feedback, like consultation issues, time, findings, what they are looking from us and what they don't want in our consultation. So what is positive, what is negative? Because, before you appear for any exam, what is the first thing that we need to know? We need to know is how the marking is done. So we'll make sure we cover all those important aspects of the exam. So first is consultation. So it says smooth consultation. So make sure when you're doing the consultation, you're not jumping here and there in the consultation. There's a pattern. You have got presenting complaint, you elaborate the presenting complaint, you ask associated symptoms, you rule out differentials, you have got past medical history, lifestyle history, social history. So go in the sequence. Don't jump. Don't jump. If your consultation is unstructured, if it is illogical or disordered approach, you will not get this skill areas, right? So they will mark you for consultation that your consultation skills are not okay. So go in the sequence, right? Again, as a doctor, is it like always I have to follow this sequence or can I just break this sequence as well? I'll give you an example on that. See, if it is logical, you can break the sequence as well. How? I'll give you an example. Just stay tuned. Now, issues. Obviously, the patient has got some issues. That's why they have come to you, right? As simple as that. So, recognize the issue. Now, the question comes, if a patient comes to you, are you going to do medical treatment first or non-medical treatment first? Please tell me in the chat box. Patient came to you, are you going to do medical treatment first or non-medical treatment first? What do you think? So, I got an answer, non-medical. Okay. Non-medical, non-medical. Okay, so most of candidates saying non-medical. Okay, now let me tell you in this way. Okay, so you got a patient who is having an exacerbation of asthma and saying, doctor, I can't breathe, my asthma is killing. And when you saw the monitor shows you the saturation is 80. And we are saying, don't smoke, don't drink alcohol, do good physical exercise. What do you think? Does it make sense? It doesn't make any sense at all. So that's why, what is a big negative? Giving health and lifestyle advices to an acutely ill patient doesn't make any sense at all. So let's give the question again. So if a patient comes to you, medical treatment first or non-medical treatment first? I don't know. I have to see the patient first. I have to see the patient first. And if I feel medical intervention is required, fine. And if I feel no, I can give non-medical, that's fine. So it depends on the patient to patient, right? Time. Time is the problem. How much time you got? You get in total 8 minutes, right? So first of all, you're not allowed to carry your watches and there won't be any clock in the room as well. So how I'm going to get the idea about the time management? So the main thing is you have got a bell system. So you get 1.5 minutes to read the task outside. So once you have read the task, what happens is there is a bell saying begin. Begin means you enter into the room. And in the room, you have got 8 minutes. In the room, after 6 minutes, there will be a bell saying 2 minutes left. And then there will be another bell which says move on to the next station. So this is how you're gonna go in the station, right? So that's a bell that's gonna help. So now, if me and my practice partner sit in the exam on the same day and say similar sentences, will the examiner think it's scripted? I mean, it can happen. So it's not about same sentence. So if you are sorry, you will say sorry only, isn't it? So it's about don't say stock phrases, learned phrases. practice those phrases nicely. So it shouldn't be like kind of stock phrases. That's what I can say. Yeah. Now, in terms of time, guys, so what do you think? You've got data gathering, you've got management and IPS. IPS is how you make your patient comfortable, right? So my question is, how much time for data gathering? How much time for management? What do you think? So you got 8 minutes. How much time for data gathering? How much for management? And there's a bell after 6 minutes as well. So what do you think? What is the best way of doing it? So one doctor mentioned 6-2, another doctor mentioned 3-5. Okay, 3-4 for data gathering. Okay, 6 minutes for data. Okay, so I got like 3 minutes, 4 minutes, 5 minutes, 6 minutes. So I got like all the kinds of answers there. Good. So I would say 4 marks for data gathering, 4 marks for management. So please spend equal time. 4 marks for data gathering. Sorry, 4 minutes for data gathering and 4 minutes for management. See, give more time to management. The reason I've seen some candidates, they fail the exam, the reason is management. The reason is not like they don't know the management, they know the management, but the problem is they don't spend enough time on the management, right? So 4 minutes, or sometimes patient is talking too much, maybe 4.5 minutes for data gathering, and rest you need to spend on the management. Management is not just telling everything to the patient. No, management is two-way conversation. Management is you need to involve the patient in the conversation. Management is you let the patient ask questions and you do the symptomatic treatment, you do specific treatment, you decide admission, not admission, addressing the patient's concern, follow-up, warning sign. There are so many things. Another thing I'll tell you, as I said, it's a bell system. So when you hear the bell, 6 minutes bell, something happens to all of us. What happens to all of us? And we tend to talk very fast. We tend to speak very fast, which is not at all good in this exam, because you have to talk slowly, you have to go slowly, and you can't rush the patient. You need to give enough time to them so that they can ask you the questions, right? So I would say 4-4, or maybe a bit more if they're talking 4.5. Don't go beyond 5 minutes. If you're taking history beyond 5 minutes, I would say you don't want to pass the station. The examiner wants to give you marks, but you don't want to pass. I'll blame you, not the examiner. So be very careful about the time management. Findings, obviously, you need to find abnormal findings or results. You will see some abnormal things in the history, in the examination, in the investigation you're going to get. So make sure you are able to find and interpret them accordingly. Examinations, use the proper instrument, and you should be able to handle them proficiently as well. For example, a station is expected that you're expected to do otoscopy, fundoscopy. So make sure you are able to hold these instruments properly as well. All right. Is there no watch? Then how can I assume 4 minutes have passed? Very good question. So it's a very challenging, doctor. I agree with you. So what you have to do is from day one, when you start practicing with your friends, you practice with the timer. You practice with the timer. So you train your mind in a way that you get a rough idea. Oh, it's now 4.5 minutes roughly. So you need to prepare yourself that way. It's difficult, but it can be done. So once you're done with the practicing 20-30 station, you will start getting a bit of idea. Okay, I know how much time it is roughly, right? Are you allowed to take notes in the exam? No, doctor, you're not going to get any pen and paper in the exam. In some station, yes, they give you pen and paper. Why they give you? For example, it is like a prescription station, you'll get a pen and paper. Some stations like MMSC, they want you to score the patient, so you'll get a pen and paper, but mostly no pen and paper in the exam. All right. I haven't got a study partner. Don't worry. We'll help you in finding a study partner. I'll tell you how, and don't worry about that. Now, the diagnosis. So what do you think? In every station, will you be able to make the diagnosis? Guys, when you're sitting in your clinic, you're seeing a patient, are you able to make the diagnosis all the time on the basis of history and examination? Tell me, can you make the diagnosis in every patient with your history and examination? Not really, isn't it? Some examinations, after taking history exam, you can, but sometimes you can't. I mean, it's not possible. So can it happen in the exam? Yes, it can happen. So what is the problem? So in your countries, when you're not able to make the diagnosis, you have got differentials with you. What do? You have differentials in your mind, and then you investigate the patient accordingly. Please do the same thing here as well. If you can show them, if you can show your examiner, I'm a doctor, I'm not a medical student, you'll pass the station. All right. But if you are just giving a wrong diagnosis without any any justification, you will lose the station. So you have to be very careful. They want a doctor. They want a doctor. They don't want a medical student, right? So what we need to do, give you a differential that the history that you have given me, I can think about these couple of differentials. So I have to investigate you. I'm going to do this investigation. Once I have the report, I'll be able to manage accordingly. But you mentioned you have cough, I'll give you something for cough. You have fever, I'll give you something for fever. You have got nausea, I'll give you something for nausea. So that is what you need to do in the exam. Are you supposed to take history and perform an actual examination? Yes, in some stations. I'll tell you, like, so some station you're expected to do the examination as well. So in that station, what happens is you have to take even little time, very short time in the history. So you're not taking full history, you're taking focused history. You're not doing full examination, you're doing relevant examination, right? So that's what happens, right? So yes, in 8 minutes, everything is expected from you. So if you're able to make the diagnosis, good. If you're not able to make the diagnosis, no problem. You are a doctor and do what you will do in your clinic and you'll pass the station. All right. Management. So the GMC says management plan must include follow-up and warning sign. So make sure you mention follow-up and warning signs to your patient before you end the consultation. Repo, make your patient comfortable. Now tell me, guys, how can you make your patient comfortable? So what is the main thing that you need to keep in your mind to make your patient comfortable? First of all, I would say, when you talk, don't just talk from here. Just the whole body should talk. You have to have that enthusiasm that, yes, I'm here to treat you and these 8 minutes are dedicated to you. If you somehow can prove it, half of the thing is done. When you enter into the cubicle, make sure you have got a smile on your face. Don't go with tensed face in the cubicle. I mean, if the patient sees your tense face, they're like, I don't know whether this doctor can help me or not. Right? So what you have to do is go with a positive mindset, have a bit of smile on your face, show that I'm confident and I'm here genuinely trying to help you out. That's what you do. Yes, you need to give proper eye contact to the patient as well. And the main thing that you need to do is listen. The thing is, most of us, we come from a country where we don't listen to the patient much, isn't it? Because we talk a lot. And I don't blame ourselves because we don't get enough time to see the patient in our country because in 2 minutes you have to see the patient. So it's too quick, isn't it? But here you'll have enough time. So make sure you have good ears. You listen to the patient carefully. Listen, listen, listen. Sometimes they just keep on talking. They just keep on talking. So what you do, you just listen to them and just notice, show positive side. Okay. So that's something that you can do to show that, yes, I'm actively listening to you. That's really important, right? So the whole body should talk. That's what I want, right? And sit with like a proper posture, not like with very dull posture. No, come on, you are young and this is how you do. Stay confident, yes. Can I tap the patient to show empathy? So can I tap on the shoulder of the patient to show empathy? I wouldn't recommend that. So I would say no, no, no. In real life, yes, we do that. But in the exam, no touching, no touching. In examination station, we do touch the patient, that too after taking the consent. So for empathy, please do not touch the patient. All right, listening and language. So listening is pick verbal cues, that's okay. Pick non-verbal cues as well. So what happens is sometimes the patient is stressed and they may not tell you. For example, what they're going to do is they might be just shaking their leg. What does it mean? It means the patient is stressed. It means the patient is anxious. So what do you need to do? You need to actually acknowledge it. I can see you're shaking their leg. Are you okay? Do you want me to do something for you so that you feel more comfortable? So you need to do these things. That is really, really important, right? So you'll have verbal, you'll have non-verbal cues as well. You need to acknowledge whatever you see, you have to say it. Whatever you see, you have to say it. That's how it works, right? Sometimes what happens is patient is doing something unusual. That's there in your mind. This is something unusual this patient is doing, but you don't say it in your words. You won't get marks for it. So to make your patient comfortable, to build better rapport, pick non-verbal cues as well. And whatever you pick, you need to say it in your words as well, right? A language, make sure you use the language which patient can easily understand. Don't use medical jargons. Use common, simple language so that patient can understand. All right, so these are the feedback statements that we need to work on when we're preparing for this PLAB 2 exam. Okay. So how the question is going to come? So I'll show you like every station. So you'll have a question outside and the same paper you'll find in the cubicle as well. So the same paper is going to be there in the cubicle as well. So for example, you missed something. Can I see the task again? Yes, you can see the task again as well in the cubicle. That is absolutely, absolutely fine. Yeah, no problem at all. Now, what kind of task you're going to have? So every single task in your exam is going to be divided into 5 headings. To be honest, when it is divided into these headings, it's easy for us to read it and to retain that information, right? So that's going to be how it is. Where you are Foundation Year 2 Doctor in Rheumatology Unit. So first of all, in every single station, you are going to be an FY2, Foundation Year 2 Doctor. Who is this Foundation Year 2 Doctor? Is an intern. So tell me honestly, as an intern, how much you know? I mean, you're doctors now, you've done your internship. Some of you are working in the hospital. You might be having a couple of years experience as well. Maybe some of you are a specialist as well, isn't it? So, but in this exam, you have to be, you're going to be an FY2, an intern. So what I'm trying to say is, don't give too much of knowledge to the patient. That can be tricky. That can be tricky as well. So you have to be very, very careful on that, right? So don't give too much of information to the patient. Is it important for us to know which department we are in? We are in GP, we are in rheumatology, we are in psychiatry. Is it important? Yes, it is important. Rheumatology unit is considered an outpatient clinic or hospital department. So doctor, it depends. I mean, mostly this station. So if you see the question, the GP has referred this patient. So most probably it is an outpatient clinic. Most probably it's outpatient clinic. All right. But if patient was admitted, they will be mentioning that in the question itself. Right. So, is it important for us to know which department we are in? We are in GP, we are in this department. Yes, it's important because the history you will take, it depends on that as well. For example, you are in the GP and you say, I'm going to admit you here. Can you admit the patient in the GP surgery? Answer, guys, in the chat box. Can you admit the patient in the GP surgery? The answer is no. You have to see the question. You cannot just say, I'm going to admit you when it's in the GP. So you have to see. So if the patient came to the GP and you want to admit, what you will do? I will send you to the hospital so that we can admit you. So it works. It really makes sense. I've been working in the hospital from the last 2 years. Does it, it will affect on my knowledge, especially diagnosis and confidence? Not at all, doctor. Not at all. Just 2 years of gap. Come on, you're a doctor. We have had candidates, those have gap of 15 years, 17 years we had those candidates. And now they're working as a GP. So no problem. 2 years, nothing, nothing, nothing. Don't worry. Don't worry at all. And if you think, oh, I forgot this and forgot everything, don't worry. Just follow what we teach you in those 12 days and you'll be good to go and you'll be able to make the diagnosis. So don't worry about that. Okay. Now, so that is your first thing. Second is who the patient is. So here they're going to tell you about the patient, like Stanley Smith, 45 years of age, referred by the GP because of the pain in the right big toe. So they will tell you a bit about this patient. So maybe when you're standing outside the cubicle, that 1.5 minute, you are just thinking what I can do, maybe think about the diagnosis, think about your differentials, your risk factors. That's something that you can do. But one thing nowadays that we have noticed, guys, they don't give us much information outside the cubicle. They say Stanley Smith, age 45, has been referred by the GP because of some problem. Which problem? They don't usually tell. So that is the problem. Yeah. Other information none. Talk to the patient, assess him, and discuss the management with the patient, with the examiner. So please check the question. The management is with the patient or the management is with the examiner. That's really important. I'll tell you most of the times nowadays the management is with the patient only. But still check, is it with the patient or with the examiner? It's going to be one of it, right? And spatial note. So, spatial note is very special, guys. Spatial note is very special. Yeah. So what you have to do, read it carefully. Right. Mainly, for example, I'll give you a very good example here. So, so the thing is, for example, you're not talking to the patient, you're talking to the relatives. You are talking to the relatives. Yeah. So, are you supposed to, or are you okay to give the information to the relatives regarding the patient? The answer is no. You cannot give the information of the patient to the relative unless you have got a consent. Right. So you have to be very careful. So in any station, if you're not talking to the patient, you're talking to somebody else, please check the spatial note if you have got consent or not. That is very, very important, right? But yes, if the patient is confused, if the patient is unconscious, then that is absolutely, absolutely fine. You can give the information to the relatives. That is absolutely, absolutely okay, right? Assuming I miss a point, can I go back do it. Yes, if it is very important, of course you can. That's not a problem. Mom with the kids would love to know how people like me can manage. Yes, doctor. So instead of like when I say how much time you need, 2.5 months or so, for you, you need a bit more time. That's the only thing, right? So we'll be able to help you out in finding a practice partners, and then you can practice with them. That's the thing. And you'll find somebody in your shoes also. So don't worry about that. Yeah. I work as HCA, okay, in the GP practice here in the UK. How can I use this to practice my interpersonal skills? So, doctor, very good thing. So, and just see how the GPs they talk to them, they talk to your patient, and maybe daily one to patient, you can also have a chat for 10 minutes and all, and try to see how they work and what they expect, and see how GPs they are working, they're talking to your patients. That's something that you need to notice, isn't it? Yeah. In the examination room, who is actually there? Patient and the examiner. It's a patient and the examiner. That's what's gonna happen. Yeah. Alrighty. So, can we prepare for PLAB 1 and 2 side by side? Is it advisable? I mean, you can do it. It's not that you can't, but I would advise go one by one, isn't it? If you take step by step, that is always better. Right. So, yeah. Is the card not carried in the exam room? Yes. You don't take the card with you. The same card is there in the room already. So, you don't need to worry about that. Okay. Exam is in the last week of Jan. When would you advise me to attend the face-to-face classes? I mean, first of all, it depends, doctor, if you are in the UK or not. I would say you can attend now the live online classes. I'll come to that. I'll come to that. I'll come to that quickly. Now, history and communication skills. What happened is, as I said, greet with the smiley face. Always make sure you introduce yourself and you identify the patient detail. Hello, I'm Ankur of the doctors. Would you please confirm your name and date of birth for me? That's what you need to do. And then you will start like, what brings you to the hospital? How can I help you? So that's how you're going to start your consultation, right? So that is must. Now, when you're taking history, so what you have got presenting complaint. Then what you do, you elaborate the presenting complaint. Then you have got associated symptoms. You rule out some differential, past, personal, social history. Now, I'm going to give you a very good example here. So, differentials. How many differentials you think you should rule out? How many differentials you think you should rule out? Tell me. In a station, how many differentials gonna be? Okay. So, doctor mentioned 2, 3. Another mentioned 3, 4, 2, 3, 3, 3, 2, 5. Okay, good, 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 good. Let me give an example. Okay, so it depends on station to station. We cannot generalize, first of all. See, if you get a station which is, say, MI, you don't have to rule out many differentials because it's a red flag diagnosis. On the other hand, if you've got musculoskeletal chest pain, you need to rule out so many differentials. Right? If you get tension headache, you have to rule out so many differentials. If you have got subarachnoid hemorrhage, you don't have to rule out so many differentials. Right? Okay, now if you elaborate the presenting complaint nicely, you will see you have ruled out so many differentials already. Let me give you an example. Tell me, guys, you have a patient. Patient is a young female patient. Patient 28-year-old female having pain in the right iliac fossa. Can you give me your differentials? Give me your differentials, guys. 28-year-old female, pain right iliac fossa. Give me your differentials, please. I'll write it here. Appendicitis, ectopic, rupture ectopic, okay, ovarian torsion, renal stone, PID, somebody mentioned, cyst, what else? Pregnancy. I think ectopic pregnancy because right iliac fossa, so that is not, I mean, much better, I would say. IBD, Crohn's or ulcerative, so I will just put IBD. What else? Anything else that you feel that I haven't not mentioned? Endometriosis? Okay. Perfect. Anything else, my friends? Ileitis. Okay, fine. I mean, I've written IBD. Okay, I can write. I'll. Okay, that's fine as well. Dysmenorrhea. Okay. Stone. I have written that. Okay. Perfect, perfect, perfect. So, gas. All right, perfect. So now what happens is whenever a patient comes with diverticulitis, colitis you are trying to. So diverticulitis is mainly going to be on the left side, left iliac fossa. If I say right, so I wouldn't consider diverticulitis maybe as my differential. I would say it's less likely to be diverticulitis. Okay. So now what you do, you have to elaborate the presenting complaint, and always we elaborate with the open question. So how can you elaborate the presenting complaint? Doctor, I've got pain in the right iliac fossa. So I'm just pointing this area. Doctor, I've got pain here. How are you going to go ahead? Tell me. How are you going to go ahead? What will be your next question? Because, if it is pain, how you going to elaborate? You're going to do the Socrates, the site of the pain, onset of the pain, character, radiation, associated symptom, time, any exacerbating or relieving factors, and then severity, isn't it? Severity of the pain. That's what you have to find out. Now, before you go into Socrates, always ask open question. Always open question. Dr. Iman has asked me a very good question. Could you please tell me a bit more about it? Now, patient is in pain. Are you going to say sorry, first of all? That's my question. Are you going to say sorry? Is it okay to say sorry, or you should not say sorry at all? See, regarding sorry, it's up to you. If you want to say sorry, it's okay. If you don't want to say sorry, that's fine as well. Sorry is not like I have given him pain, that's why I'm saying sorry. No, it's just for acknowledgement. It's for empathy, we say in this country. But your tone of voice, that matters a lot. Sometimes some candidates they're like, I'm sorry, tell me more about your pain. Don't do that. Or you can say, oh, I'm really sorry. Are you comfortable to talk? And then, okay, tell me more about your pain. That's how it needs to be done. Sometimes we don't say sorry, but our tone of voice is enough. Doctor, I've got pain here. Ah, okay. Are you okay? Are you comfortable to talk? That's fine. So this is what you need to do. I know it's a medical exam. I know it's a communication exam, but you need to understand it's a bit of acting exam as well. All right. Saying sorry, you decide. But whatever you say, if you say sorry, say it from here, from your heart, not just saying words. Okay. And the next question should be, could you please tell me more about your pain? That's what you do. Could you please tell me more about your pain? So it's an open question you need to ask, right? So site, it's here, doctor, right iliac fossa. What else you want to know? So sometimes patient says, what you want to know? So ask me question, I'll answer. Tell me what else you want to know. So somebody asks, is it going anywhere? No, doctor, it started there and it is still here. So it started in the right iliac fossa, it's still there. Scoring, it's 5 out of 10. When did it start? It started yesterday, doctor. Can you describe the pain? It's dull pain, doctor. Anything exacerbates or relieve it? I would say paracetamol helps, doctor. Nothing makes it worse. Pain scale, I've given doctor 5 out of 10. It started gradually, doctor. Right? Okay, so associated symptoms, I'm gonna come, and it's not radiating. Right? Not shifting, no radiation, no pain anywhere else. Okay. When was your last menstruation? Wait. Now what happened is, if you ask too many questions, it's not gonna be okay. So what we did, we just did the Socrates. Obviously, any associated symptoms we're gonna ask. So what I'm trying to say now here is, tell me, the patient's pain started yesterday. It is 5 out of 10. And it is dull in nature. Patient is taking paracetamol, which helps a bit, and gradually the pain started, and it's not radiating anywhere. Okay, now let's see. So can it be appendicitis? First of all, can it be appendicitis? I'll say it is not appendicitis, because what happens in appendicitis, it starts from the center, then it goes to the side. There's less likely to be appendicitis. Can it be ectopic? I'm not sure. Maybe yes. I'll keep it that in my mind. Another thing that we said, it could be ovarian torsion, isn't it? So can it be ovarian torsion? I said pain is 5 out of 10. It doesn't look like ovarian torsion as well. Can it be renal stone? I don't think so. It is renal stone, because pain is from loin to groin, and pain is going to be very severe as well. Can it be PID? Maybe yes. I'm not sure. Let's see. Can it be cyst? Maybe. Why not? Can it be IBD? Maybe yes. Endometriosis? Yes, I have to see about the periods and all, then I'll check it out. Ileitis, yes, I need to ask questions about the abdomen, the diarrhea, constipation, so I'll see that. So what I did, if you see, I didn't I didn't try to rule out anything. But if you see, I was able to rule out many differentials just By elaborating the presenting complaint. So if you elaborate the presenting complaint, you will be able to rule out so many differentials unknowingly. You don't even know, but you rule out so many differentials. That's what I'm trying to say. So elaborate the presenting complaint nicely. After that, what happens is you need to ask an open question again. Anything else? Do you have any other symptom? Any other associated symptom. So, for example, this patient said, I don't know, doctor, this is the main thing I've come up with. I just have got this pain. Then you can ask some question because you have got some differentials in your mind. So you will ask questions accordingly. So you're thinking about what should I ask? Can it be PID? Yes, it can be ectopic. It could be IBD. I've got a few things going on in my mind. So I'll start with any question. So you said nausea, vomiting. Okay, let's ask nausea, vomiting only. Do you have nausea, vomiting? Yes, doctor. I have nausea. Uh-huh. Okay. What else I should ask? You tell me. So I've got nausea as well. Nausea. I haven't vomited, but I've got nausea since yesterday. Somebody asked fever. Yes, doctor, I'm having fever as well, but I'm taking paracetamol for my pain, so that is helping me in my fever as well. So what I understood with fever, it is infection. It is infection. It is infection. So wait for it. It is infection. Which infection it could be? It could be PID. It could be IBD. It could be endometriosis, maybe. Fever is not there, but I'll see. Loose stool. Okay. Any problem with your bowel? Any diarrhea, constipation? Any diarrhea? Any constipation? No, doctor. If I say no to it, what happens? With one question, what happened? So it's not ileitis, it's not IBD. Yeah. And then obviously it's a female patient. So what else you can ask? You can ask for, as you asked, vaginal discharge. Vaginal discharge. So, doctor, yes, I've got vaginal discharge as well. Okay, you have got vaginal discharge. So, go in detailing of it. Since when we are having it, and what is the color like, smell like, how much it is, go in detailing of it. So, you are able to make the diagnosis about maybe it is infection, PID. We are going more towards PID. That's what is happening here. Now, for making the diagnosis of a PID, what you need to do, you need to ask some other questions as well. Like you can ask for STI, PID, but you can ask like any problem with like any itching in the private area, right? Any ulceration in the private area. These are the questions that you can ask. Now, to make the diagnosis of STI, PID, you need to take sexual history as well. You need to take sexual history as well. Now, one thing that a lot of people they tell me, the sexual history is a kind of part of personal history somewhere here in the later part of the station. I know, but do I need to take sexual history in the personal history, or should I take it a bit early here now to make the diagnosis? What do you think? I've seen candidates with the different opinions. They say no, I have to take in the end because otherwise it's gonna break my consultation sequence and all. The thing is, if you will not take sexual history, how can you make the diagnosis? So that is the thing I was telling it to you that time when I was explaining that point, that sometimes you need to break this sequence as well if it is making sense, if it is structured properly. So yes, you need to take sexual history now, because if you'll not take sexual history now, you end up having nothing. You won't be able to make your diagnosis. So that is really, really important. So can I break the sequence if it makes sense? Yes, why not? Right. So sexual history, you took patient has got multiple sexual partner, unprotected sex. So it is easy for me to make the diagnosis now. Now I want to rule out ectopic as well. I'll ask, when was your last menstrual period? Doctor, 2 weeks ago. So it's not ectopic as well. And obviously no endometriosis because it's not, there is no fever in endometriosis. And I said that periods are 2 weeks ago, so less likely to be endometriosis. Now for ovarian cyst, can it be? Maybe. But then it's why the patient has got, for example, the fever and other symptoms. It's less likely to be ovarian cyst, but moreover, I'm going to do later, I'm going to do an ultrasound as well to make sure I'm ruling that out as well. Now, come back to the station. So if you see for differentials, if you see how many questions I asked for differentials, I would say I asked like diarrhea, constipation, nausea, vomiting, fever, vaginal discharge, 3, 4 questions only. And if you see how many differentials I ruled out almost 10 differentials, right? That is what you need to do, guys, in the exam, right? You are not supposed to ask so many questions. You're not supposed to give so many medication. Who's a good doctor? Who asks less question and who gives less medication? That's what you need to do. All right. So this is how you need to take history taking in the exam. So tell me more, anything else? Tell me more, anything else? Keep asking open question and you'll see you get a lot of things from your patient. Right? You didn't go to the patient. Come on, patient came to you. So obviously they'll tell you what the problem they have got. Right? And then obviously differential past, personal, social history you can take. Yeah, so that's how we're gonna go. But presenting complaint, if it is pain, you go for Socrates. If it is cough, shortness of breath, we can elaborate by Odipara as well. And if it is fit for loss of consciousness, dizziness, vertigo, you need to take history in three parts: before, during, after. Before, during, after. That we will discuss some other day. Otherwise, it's gonna take too much of time, right? Now, I've put the whole summary, what you need for data gathering in this particular slide. Have a look. And I'll just cover it in 10 minutes and then we will be good to go. So, any history taking station, how it works, you start with, how can I help you? That's an open question. Always start with, how can I help you? It's an open question, right? And then patient will tell you, doctor, I've got pain, I've got cough, whatever they have got. And then another open question is, tell me more about it. Always let the patient talk, because sometimes what happens is, doctor, I've got pain. And we're like, since when you have got pain? No, don't do that. Simply say, tell me more about your pain. Right? That's the thing. I saw somewhere else that is it Ford-para instead of Odipara. I mean, doctor, it doesn't make any difference. All right. It's just like still the standard guidelines, they follow Odipara only, right? But some other tutor, they might have started teaching. So they want to teach according to their own style. And that's why they might have made the changes. But the standard guidelines still follow Socrates and Odipara. All right. So, how can I help? And then tell me more about it. And what you do is you elaborate the presenting complaint properly. Whether it is Socrates, whether it is Odipara, make sure you complete it properly. So, what's going to happen when you complete your Odipara or Socrates? You will see you are able to rule out so many differentials as well. And you'll see somehow you'll be coming to your diagnosis as well, right? So, once you're done with the elaboration of your complaints, the next question, I know like when we were discussing the station, you guys started asking me so many questions, nausea, vomiting, and then vaginal discharge, fever. Wait. Before you ask any question, you wait. You ask one more question. Is there anything else? Because what I want you to do is get everything from the patient first. I know your time will come. First, get everything from the patient. You have got pain. I've done the elaboration. What else you have got? I've got that is it, doctor. Okay. And then you'll start asking any fever, any nausea, vomiting, any vaginal discharge, any when was your last menstrual period? Then you ask all those questions. So remember, whenever taking history, two questions I want you to remember. Life will be easy in the exam. Tell me more about it. Do you have any other symptom? Tell me more about it. Anything else? Life will be easy. Yeah. So after doing that, obviously, you have got one symptoms or you have got two symptoms. Based on that, what you're going to do is you'll have some differentials in your mind, the way we discussed. So what you can do, you can ask some associated symptoms to confirm your diagnosis, to put a stamp on your diagnosis. Okay, that's my diagnosis. And you will rule out some differentials which you have not ruled out. Because, when you have elaborated the presenting complaint, you've already ruled out so many differentials. So what you have not ruled out, you can ask questions now and rule it out. That's what you do. All right. Then you have got questions about past medical history, like previous similar episode, medical illness, medication, allergies, hospital stays, surgeries, family history, smoking, alcohol, diet, physical activity, stress, drugs, sexual history, travel, occupation, living condition, driving. So many questions, my friend. Am I gonna ask all these questions? That's the point. Are we gonna ask all the questions? Not really. You need to ask only a few questions. I mean, I would say hardly 4 to 5 questions. Maybe you need to ask from the whole list. There are like 18, 19 questions there. If you guys gonna ask every single question, it's gonna take 2 to 3 minutes of your time, and you don't have that much of time. So what you do, you ask 4 or 5 questions only, which you feel is the most important. Let me give an example. You got a case where you're suspecting it's lung cancer. So which are the questions I should ask? Previous similar episode, family history, smoking, and occupation. That's it. These 4 questions, I'm gonna go ahead to my manager. That's what you need to do. You're a doctor, you know which question to ask, which question to skip. And if you ask everything, difficult, my friend. So skip, skip, skip. And you need to do the history in 4 and a half minutes as well. So if you're gonna spend 2, 3 minutes just here, how we can go about it? You can't. So be very careful, right? Ask less and less questions. Then maybe you can ask, is there anything else that I should know? Sometimes when you have got a good rapport with the patient, even if you're missing something, they might be able to help you out. Yeah. Patients concerned, they are of utmost priority. Impact of the illness on the patient's life. That's very important. If a patient has got any chronic illness, if the patient has got any chronic illness, you ask how it has impacted your life in general. For example, your patient is feeling tired for last 3 months. Tiredness, I'm going to treat. I'm going to find the reason I'm going to treat. But ask how this tiredness has affected you mentally, for example. How it has affected you in general. You're not treating the patient medically, you're treating the patient overall, and that's very, 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 very important. Yeah. After this, what you do the examination, you do investigations as well. Because before you give the diagnosis, you can mention what examination investigation, because sometime what happens is they might be giving you the examination and investigation findings as well. And based on that, you'll be able to make your diagnosis. For example, the patient gave you the history. I've got a young female patient. She said, Doctor, I've got pain here, somewhere in the suprapubic area. I'm going to the loo more often. I'm having fever as well. What comes in your mind? Tell me. Young female, pain suprapubic area. I'm going to the loo more often. I've got fever as well. And I sometimes feel smelly, cloudy urine as well. UTI, yeah. I'm kind of 99% sure it's UTIs. How can I be 100% sure? So I would say examination. I would like to do your general physical examination. I'm going to check your vitals, and I'm going to do your abdominal examination as well. I'm going to send some routine blood test, and I'm going to do your urine test as well. And they might be able to give you the urine dip finding, which says patient has got leukocytes and nitrates in the urine dip. What does it mean? UTI. So based on the history, based on the examination, based on the investigation, you will give your diagnosis, right? That's what you do, because you need to disclose and explain the diagnosis and explain that investigation and examination finding as well. Meaning, what I mean by that? Sorry. What I mean by that, explain the examination investigation finding. What does it mean? Do we need to get a urine test for all the UTI patients? Of course, urine dip. How long it takes for doing a urine dip? It doesn't take time, isn't it? So yes, you will do that, right? So now, what you do is when you give the diagnosis, how it works, So you mentioned like the history that you have given me, that you're going to the loo more often, you're having fever as well, you're having nausea as well, and you're having pain in this. Moreover, when we did examine, we found yes, your temperature was high, and we found there are certain kinds of cell like new leukocytes and nitrates in your urine samples. All these things are suggestive of you have got a condition called urinary tract infection. This is how you need to go about it. This is how you will go about it. Okay. So yes, doctor, when the patient has got fever and all those symptoms, most probably it's UTI, we will say. Yeah. So that's how. So disclose and explain the diagnosis and justify your diagnosis as well. When you give the diagnosis, gives you positive findings as well. Like that's why I'm saying this is UTI. And yes, we're gonna send for culture as well before we start the patient on antibiotics and all. Yeah. Do we do a pregnancy test while doing the urine dip just to rule out the pregnancy? And of course, or in the history, I've already asked if the patient is sexually active or not, and when was the last menstrual period. But if you've got any doubt, of course you do it. Perfect. Good point. What is this ICE, guys? ICE. Let's talk a bit about this ICE. Idea, concern, expectation. Right. So what happened is now a lot of candidates ask me one question like when I'm taking history and I'm blank now. I don't know what to ask next. Can it happen? I think it can happen with everyone, isn't it? Like while taking history, it's going well and all of a sudden I'm blank. What should I do? What do you think we should do? I always advise do ICE. Idea, concern, expectation. In this country, we do that quite often. Quite often. A lot of people, they're like, it sounds a bit odd. Do you have any idea what's going on? Are you concerned about anything in particular? Is there anything else you're expecting from today's consultation? I mean, if I ask the patient, do you have any idea? Patient is going to say, you're a doctor, you tell me how, why are you asking me? No, it doesn't happen like this in this country. It is a kind of routine to ask this idea, concern, expectation, and that we do kind of very much regularly in our GP settings or even in the hospital as well. Please do eyes in every station. Now the question comes where I should do eyes. I'll say do wherever you want. For example, you're taking history and all of a sudden you're like, I'm blank. I don't know what's my next question. I'm struggling to make the diagnosis as well. So what should we do? As the patient. So do you have any idea what's going on? So what happened is they might have any idea because they might have Googled it. Patient has got, like for example, patient has got blood in the phlegm for last 2 weeks. Do you think patient has not Googled it? Of course they have Googled it. We as a doctor, if you have got any problem for last 1 2 days, do you Google it? Of course we do Google being a doctor. What do you think about the patient? Have they not Googled? Of course they have. So what you need to get their perspective as well. So ask, do you have any idea what's going on? Ah, doctor, I'm not sure, but I'm just worried about cancer. Ah, I can see you are worried. Cancer. Let's ask him cancer question. Do you have any weight loss, any appetite loss? So what happened is you got your question as well, what to ask next. And it can happen under stress. It can happen. Sometimes this doesn't work. And you need a minute to reset it. Okay, how can it work again? So this is the hint. That's something you can do. So now people ask me, they also use AI these days. Yes, I mean, they use too many things, but doctor in the exam. So I would say this is the best thing that you can do. Yes, I mean AI is being used everywhere nowadays, but AI is still AI. Human brain is still better than AI, isn't it? So yeah, I mean diagnosis it's you who's gonna make even in the real life as well. Yeah, so that's what I'm saying. I know I have written here in my slide. I mean before diagnosis, definitely I want you to do eyes, but it's not like you have to do it here only. You can do anywhere in the station, but please do it. Please do it. Without eyes, it's difficult. Now, a lot of people ask me how expectation is important. Like, what are you expecting from today's consultation? It looks a bit odd. I'll give you an example. We have a station on tension headache. See, tension headache, the treatment is very simple. Do yoga, meditation, whatever is giving you tension. So start working on that as well. And we give some lifestyle advices. If patient is a smoker, no smoking, alcoholic, no alcohol, good diet and good physical activity. That is kind of a management of tension headache, right? That question comes quite often. So what happened? This question came and the candidate said everything. What I just mentioned, they mentioned everything. And what happened in the management? They got 1 mark only. They're like, no, I said everything. Why I'm getting only 1 in the management? Why I didn't get all 4 in the management? The thing is, you didn't fulfill the expectation of the patient. It's like, what is the expectation? The patient wanted a CT scan, but we don't do CT scan in tension headache. I know, but patient wanted that. But why? The patient didn't tell me. Yeah, because you didn't ask me. You didn't ask the patient. So it's like, I mean, how does it work? This is how it works in this country. So Britishers sometimes they won't tell you things very easily. You need to dig into it. Then only they're gonna tell you. So, for example, when you are ready with your management plan, you're about to say the management plan, tell the patient, okay, the history I've gathered, I come to the conclusion that you might be having a condition called tension headache, and I'm going to do the management of it. Right. But before that, I just want to ask, do you have any other expectation from this consultation? And the patient must say, oh, doctor, I want a CT scan as well. Okay. So now when you give the management, you will keep that question in your mind as well, and you will be able to say things about CT scan as well that it is not required in this particular case. So that's why expectation is very important. So can I do eyes? Yes. Where I should do eyes? Do wherever you want. Can I do eyes separately, C separately, E separately? Yes. Can I do eyes more than once? Yes. Right, you wouldn't do CT scan. Yes, you will not do CT scan. And you will explain it to the patient why we are not going to do it. And we don't do it unnecessarily because this is harmful radiation as well, isn't it? So that's how you do it. Should we do eyes in every case? Mostly, not every, I mean, we can't generalize things, but mostly cases you should be doing this eyes. It's very helpful. Trust me, guys, if you are not able to make the diagnosis, after doing eyes, you will have your diagnosis with you. Trust me. Right? Then further investigation, if you want to do, then treatment, symptomatic treatment, specific treatment, medical treatment, non-medical treatment. Are you going to do medical treatment first or non-medical treatment first? Tell me. Medical treatment first or non-medical treatment first? Depending on the patient. That's what I wanted to hear. Yes. It depends on the patient. Yeah. And then admission, you will decide the admission. If you want to admit. If you want to discharge, you will discharge. Right. If you're not sure, please take the help of your seniors. Do I need to involve the seniors in every case? No. Why? If you need your help only, then you will involve them. Right. And then follow-up and warning sign, it's a must. Do give follow-up and warning signs as well. And in the end, you can mention that I'm going to give you some leaflets as well. That is absolutely fine as well. All right. So that's the main thing that we should be having. Right. So this slide actually covering everything. I can send you this PDF. Don't worry about that. So this slide, if you can properly put it in your head, you will not have any trouble with any history taking. Trust me, guys. All right. Now, a few important pointers I'm going to tell regarding IPS. So you have understood things about data gathering. You got things about management as well. What actually comes in IPS and interpersonal skills? What comes is active listening. So make sure you listen to the patient carefully. That's really important. Signposting. I didn't talk about signposting. What is signposting? When you're moving from one part of the station to the other part of the station, you can signpost it. For example, you're going to start now lifestyle history. You're going to talk about smoking alcohol. So what you can do, you can signpost it. Instead of saying straight away, do you smoke? Because this question came all of a sudden. I wasn't expecting you're going to ask me that question. So you can signpost it. What does it mean? Now I'm going to ask you some questions about your lifestyle, your smoking, your alcohol. It might be related to your case. So tell me, do you smoke? So this is what we call as signposting. Summarizing in the end, when you give your diagnosis, you can summarize it as well. Ice. I can't stress it enough. It's the best thing that you have to do in the exam. Positive body language. When you talk, have to have positive body language. That's really important. Involve the patient in the management. That's what I'm saying. Management is not just telling the management. Management is involving the patient with the management. When you give the information, you give in small chunks, and check the understanding of the patient. Yeah. And make sure you respond to the cues as well. Respond to the verbal, non-verbal cues. Yeah. So these are the things that comes under IPS. Yeah. How important is eye-to-eye contact? Is one of the very important thing, doctor, for interpersonal skills. Yeah. What's about dosing? Do I need memorizing them or checking the BNFs? You don't need to memorize the dosage and all. No worries. It's there in the BNF, or no, be honest, nobody asks. And if the patient is asking, the BNF is there in every room, so you can open it and check it out. No problem at all. BNF is British National Formulary, guys. So that book is going to be there in the room. All right. So for important pointers for the PLAB, trust yourself. That's really important. I know a lot of you might be thinking my English is not good. I may not be able to talk well in the exam. See, you have passed your English exam. Just trust yourself. If you pass here, you'll pass in real life as well. Pass it here. I know what I'm doing. I'm the best. And that's how you can do it. Now, in IELTS or OET, when we prepare, our instructor used to say, use complex sentences, then you get high score in OET and all. Here, I'll say use simple sentence, small sentence, the sentence which you can easily say. That's the beauty about this exam. Practice in front of the mirror, because some of us were worried about our facial expression. When I'm going to talk, is it going to look good, bad? So what you can do, you can practice in front of the mirror and see yourself. That helps a lot. What you can do is record your consultation as well. Record your consultation, maybe like daily 1-2 consultation, you record it, and in the night when you're sleeping, just listen to it. See how I answered it. Did I answer it in a better way? Could I have answered it in a much better way? So answer yourself. That's really important. Be strong mentally. That's really important. Be confident. Even if you don't know, say I don't know. See, who you are. You are an FY2. So you are expected not to know things. You're not a medicine or surgery or gynae or pediatric specialist. You're not. So if I don't know anything, then if I don't know about that, see, I don't know. I don't know. I'm really sorry. I'm not sure about this answer. I know it's very important for you. Let me have a word with my CA and I'm going to come back to you. Say it with confidence. But sometimes what happens, they ask a question, you don't know the answer, and you try to make an answer and you give a wrong answer. That is the worst thing. If you give a wrong answer, you are not a safe doctor anymore. They don't want a doctor who knows everything, because that's impossible. They want a doctor who is safe. So be safe. Yeah. Reassurance, trust your language skills. Relaxed mind can do wonders, right? The main problem is many of us, we don't have enough time for the preparation. When we don't have enough time, our mind will not be relaxed anymore. So that is the problem actually. So be careful on that. Yeah. So we're not allowed to make any notes during the history taking. Yes, you're not allowed. It means we need to memorize everything patient has shared. That's true. That's true, my friend. Yes, doctor. Yes, that's absolutely correct. So that is it, what I've got for history taking. I know I took, I think, a bit longer. It took a bit like an hour, right? So now I'm going to tell you a bit about the Aspire and some discount coupons that we have got. We're going to share it with you. And if you've got any question regarding our academy, I'll be able to answer that as well. All right. So I hope you enjoyed the session, and that's how we do. I mean, the things. This is I'm doing from my house, but then our all the courses are live telecasted from the academy, and I'm saying we are the only academy doing the live 12 days sessions. All right. I know other academy, what happened is they're doing 1 day, 2 days, or 3 days. That's it. We do everything: medicine, surgery, gynae, peds, counseling, ethics, examinations, and man. Everything is done in person. And we give you recorded session, that's one thing. But we actually practice with you in the academy, in the classes, daily, in our whole 12 days. You know how many stations we practice? We practice roughly 150 stations. Half of your exam we practice in the classes only. Right? So daily, this is what happens, and nobody is doing it. A lot of things you'll see, they have got only recorded sessions. You will see they have got only, just Simman classes or examination classes. That's it. But for us, we do all 12 days live. I do it, Nikhil do it. We are the one doing the most of the classes for you guys. All 12 days. That's how it is. When is the next session? I'm gonna come to that. So recorded lectures and online live is course. How about face-to-face? Yes. So whole thing. So in person and live online. So what happens is, if you are in the academy, you can do it from the academy. right? So live in person. And all our live sessions are live telecasted as well. So you can attend it online live through Zoom, right? So that's how it works. So the schedule for online session, I'm gonna show you. These are the schedules. For example, then this batch is actually, the batch is going on from 15 September to 26. So batch is actually going on. It's in the middle of it, right? The next batch is gonna start from 6th of October to 17th of October. Another is 27th October to 7th November, 17th November to 28th, then December, and then so on for 26 as well. So this is live session, guys, live sessions, right? We don't do it like, okay, we just have a mannequin practice and Simon practice. No, we do every single department, medicine, surgery, gynae, peds, psychiatry, counseling, ethics, every single station, every single topic we practice. Breaking bad news, for example, when I teach it quickly, and then we practice 3 stations. Domestic violence, I teach and then practice 3 stations. That's what is all about. That this exam is not only just examination mannequin. It has got other things as well. So I know most of you are working as well. So how can I do it? You can attend it live online now. You can attend it now. And if you're able to attend only few classes, you can attend rest of it in the next batch. And then if you miss something, attend in the next batch. And whenever you can come here and practice with the students and maybe attend it in person as well. How many times I can attend the live session? Once, two, three, four, five, six. As many times you want, no problem at all. That's the main thing, right? We have got pre-recorded videos as well. And there are some academies, they say their pre-recorded videos is the whole course. Come on, we have got pre-recorded videos. We're going to give it to you. But that's not something we say is enough for your PLAB 2 preparation. We do the live sessions. We do practice with you guys. That's what you need, isn't it? Then you have the mock sessions as well, mannequin practice, Simban practice, post-course support. Some academies, they have got post-course support session and that is their course only. Come on, that is free that we're giving. That is not our course. Post-course support is after the course. First we do 12 days and then what happens is every day we have got some activities happening in the academy. For example, one day we'll have the prescription session practice. So it is post-course support. So will come and then you will be filling the prescription, then our tutor is going to check it out. Then next day we have got the Simban practice happening. Next day we have got the mannequin in the small groups practice happening. Next day the mannequin teaching is happening. Another day spam session happening. The sessions are happening, they're post-course support sessions. And this is not our course. Our course is 12 days separate proper course. And as I said, I'm proudly saying this, we are the only academy doing this. Nobody else is doing. And I'm saying it. If there's anybody doing it, tell me who is it. I can challenge them. Right, so we have got the academy access support till you pass, exclusive WhatsApp group we have got, and then you will be able to practice with the faculty daily. We practice, so it depends. Like when I'm practicing, when I'm teaching ethics, I practice at least 20 station in one day. 20 station. When we do counseling, at least we practice more than 10 station in one day. When I teach medicine, I practice at least 8 to 10 station per day. So in total, in 12 days, we're able to practice around 150 station, guys. 150 stations. That's what happens, right? So post-course support, for example, this is our post-course, and some academy, they say this is their course only. This is not our course. This is our post-course. That's the difference, right? Hands-on mannequin. What happens in hands-on mannequin? So you will be divided into small groups, and you will have like you will be going into 4 rooms, and you'll stay there 1 hour in one room, and you'll be doing some mannequins, and there will be an instructor who is supervising you and correcting your mistakes. That's how it works. Then we have got mock sessions, self-assessment mocks. So what happened is now somebody asked me, how can I find the practice partner? So this session helps you in finding a practice partner as well. When you're in the academy, what happens is we facilitate this thing. So you will be practicing with other friends. So in this session, spam session, you will be practicing at least say 10, 12 stations with 10, 12 different people, including our mock examiners as well. So what happened is today, you don't know anyone from the academy, but after this session, you will have more 12 friends and you can start practicing with them afterwards. So it's just we'll trying our best so that you guys mingle up and then start practicing amongst yourself. Then we have a prescription writing session happening. This is the schedule for this batch actually. So on Monday, this is 22nd, this is what's going to happen. So in the 24 we have teaching sessions, a mannequin teaching session. So this is happening separately, and our course is going on as well. So two rooms are, one room the regular classes are happening, another room this post-course support sessions are happening, and you decide what you want to do it. So if you want to attend the whole session because you have not attended it previously, attend that. Now if you're like, no, I've attended that session, but I have some doubts, I want to practice and I want the tutor to correct me, go for post-course support session. So you decide what you want. That's what it is. Then spam, and then sim and practice session, and for sim and practice we also have one thing, like we make small groups, and then we will let you feel the pulse, check the blood pressure, listen to the heart, listen to the lung sound. So we do that as well. So this is our session, right? So we have got post-course support session, we have got the full class recorded live online, everything. Nobody is actually doing these things. Now once you enroll, how we want you to practice. First, you can start with the live online class. Now, I know a lot of them, they're like, okay, my exam is in February, my exam is in March, my exam is in April. When should I start preparing? Why can't you start today? Because you start today, you enroll into the course today, or you enroll after 2 months, your validity till you pass. Right. So why are you not starting it today? And you can start slowly. See our recorded class or see our live online class. When I attended, oh, I was able to attend only 3 days. It's fine. Attend next 9 days in the next one. Oh, in the next one also I can attend only 3 days. You can attend the next one. What is the problem? There is no problem. We are flexible in that, right? So that's what you have to do. Stream from the classroom, attend that live online, and you will see in the beginning, I know you are a bit hesitant to practice. So what happens is you will be able to see other people practicing, and that will give you confidence as well. And you will see how the consultations are done. That is what is required in PLAB exam, isn't it? Right, and then you can watch the pre-recorded videos as well, and you'll have the access to the study material. See, lots of study materials are there in the groups and all. Don't get confused, guys. Don't get confused, right? I mean, this exam is not about reading. This exam is about practicing. I'm sorry to say, but then what happened is, I'm not saying their notes are bad, my notes are good. I'm not saying that. What I'm trying to say is this exam is not about reading. This exam is about practicing. Don't read 10 notes, because when you read 10 notes, you don't have time to practice. That is the reason a candidate is failing nowadays. Don't do that. Don't do that, please. Exam is not about reading, it's about practicing. Practice, read once, practice 10 times. That's what is required, right? So once you are done with the recorded and the live online sessions, you actually feel I'm kind of prepared for the exam before you come to the UK. So when you come to the UK, what you need to do? You'll attend this 12 days face to face. Oh no, I don't have enough time in the UK. So do I need to attend all 12 days? No, you can pick and choose. You can attend half of it. Why you need to attend the whole of it? Oh, I need to attend Simban only. Attend Simban only. I need to attend only examination mannequin. Attend that. You decide. That's the thing. And you'll be able to practice with the faculty during the class, then give the mock exam and attend the post-course support session. So when you come to the UK, if you've got more time, 4 or 5 weeks, then attend the full session. That's fine. But if you've got only 2 weeks, then maybe instead of attending the full course, you can attend the post-course support sessions. So you can decide what fits for you. That is the main thing. So that is our quick plan, right? And these are things, I mean, so these are our batch details, batch dates, because it's live, isn't it? So we have to have batch dates. So that these are the batch dates that we have got. Let me take some questions. My exam is on 3rd March, looking for cancellation if I get early, as OET is expiring in April, a resident of the UK, but as of kids can't do it in person. I would really appreciate if you can help me out the plan. So your plan is going to be, doctor, you can attend this live online classes. You will have the pre-recorded videos as well. So these are the two things. When you're staying at home, you can start with these two things, right? Our course is going on, or the next is going to be on 6th of October. Maybe enroll into that and attend a few days so you get a bit of idea how I need to prepare. And then these recorded videos you can see at your own convenience as well. And spend 2 months at see daily 1-2 hours videos and attend our 2-3 lives, these 2-3 batches, I would say. Right. And then you're like, yeah, I'm now prepared. And you have the book PDF as well. You can start reading those as well. Then everything will start making sense. That is, I think you should be doing it. The schedule for the online live session. So this is doctor, and the schedule, like what is going to be happening on day 1, what's going to be happening in day 2, that we share. So a couple of days before the batch starts, we will share the proper 12 days schedule as well. Yeah. Can you elaborate what happens in the 12 days live session? Are they lectures or hand-on practice? See, not lectures. See, lectures we don't do much. So what we do in our session. So for example, I'm teaching cardiology. So I'll teach about chest pain, heart failure very quickly, in like very fast, quickly, 10-15 minutes. Then I'll call one of you on the stage. I'm the patient, you are the doctor, and I'll give you a scenario. So you have a patient, you are in accidental emergency. You have a 55-year-old Mr. Smith, and he has got chest pain. Go and talk to him, assess him, and discuss the management with the patient. And you put the timer and you do the consultation with proper things. All right, so this is what we do. Next day, for example, we are teaching ethics, breaking bad news. I'll teach you breaking bad news quickly, and then I'll call one of you on the stage and we'll practice breaking bad news. Then I'll teach you domestic violence. I'll call you on the stage, you'll practice domestic violence. Then I'll teach you treatment refusal. I'll call you on the stage and you'll practice treatment refusal. Then I'll teach you angry patient. I'll call you on the stage and practice angry patient. This is how it is done. That is how it is. Not just like you just attend the recorded course and then you'll get everything. No, it's not like that. It's not like that, right? Will you be able to add a data interpretation course for Prestige Ireland as well? I mean, we can do that, doctor. So if you can email us and we will be able to help you out that. So email us at info@aspire-PLAB.com. Yeah. Individual practice will be there. Yes, yes. So you have got the practice area separately. You can practice individual. That is absolutely fine. No problem. So you have unlimited access to live and in-person session. Yes, yes, yes. If my exam is in March, when should I attend? See, attend October batch maybe live, online maybe, right? And attend few classes so you at least you'll understand what this exam is all about, how this exam is gonna go, and then you can start reading a bit and start attending the sessions. So why not start from today itself? Why are you waiting till I'll start in January? You can start now, slowly, slowly, isn't it? Live classes will be there on Saturday, Sunday too. Yes, 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 yes. It's daily. So it means our subscription doesn't expire. It won't. I mean, till you pass your exam, you are our student and we'll help you out till you pass this exam, doctor. Yes. I'm interested in the Irish exam. Please contact me. Maybe we can work together towards press or Dr. Ali. Okay, we can help you. So if you email us and we can make a group and we can connect you guys, no problem. The practice session at the academy, can I come as long as I want to practice? Yes, yes, yes. You can come to the academy till you pass your exam. Yes. So, your pre-recorded videos are enough for preparation and other notes available in the market. See, if you are following other notes, I would advise you to follow their course only, doctor, because I want you to pass this exam. So, if you attend somebody else's course and just look at somebody's notes, you will get confused. And I don't want you to do that. Please don't do that. That's my advice, right? My pre-recorded classes are enough or not. I don't say that because I want you to attend the live sessions. You practice with the tutor, then only I can tell your mistakes, isn't it? That's how it works. Yeah. Follow one, that's what I would say. If you follow too many, you'll end up in confusion, right? So, too many cook, what they do, they just spoil the dish. Please don't do that. Please don't do that. I know this is what is happening nowadays in the PLAB-2 market, but please don't do that. That's my humble advice to you. Can I come and practice in the academy after my in-person course? Of course, that's what you need to do. You can start practicing. When you enroll the course, you can start coming to the academy from the same day. Yeah. I'm from Nepal. Can I take the live sessions now and visit the UK in person? That is what I want you to do, Dr. Samar. Yes. Attend now live online. Maybe in this batch or the next batch starting from 6th of October. And then when you come here, you can attend it in person as well. Yes. Suppose I'm buying the course now and my exam is in Feb, so I can keep attending the classes in person or only. Yes, 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 yes. What's the timing of those 12 days? So, doctor, it starts at 10 and finishes around 5. So 10 to 5, I would say. 10 to 5. Do you have notes that we can read before attending? Yes, we have the notes as well. So once you enroll, you'll be getting the access of the notes as well. And those PDFs will be given it to you. And what happens is nowadays, whatever changes happen, so we keep changing it as well. So every month you will see the new PDFs are coming as well. Yeah. How many stations in total we need to prepare? See, I mean, I don't consider how many stations. I'll say how many topics you are doing. That is much better, isn't it? How many topics you are doing. But stations, there are around 500 stations, my friend, nowadays. Is there enough mannequin available for everyone to practice? Yes. I mean, see, it's a big practice area, big. I'll send you a video. You'll be able to see our academy there. Okay. In the video, we have actually made a nice video which shows the whole of academy. Enough space. I mean, In this corner, somebody's practicing eye and ear. In this, somebody's practicing antenatal. In this corner, somebody's practicing blood, ABG, parectal examination, and then other like hernia exam. So they're just practicing different. So it's enough space. Don't worry about that. Can you show the course dates again? It's there, doctor, on the screen. You can have a look. Can I do just mocks? Yes, you can do that. Just email us to info@aspire-PLAB.com and we'll be able to help you out that. Yeah. How about people who feel they still have some knowledge gaps? Attend our 12 days. You don't need anything else other than that. That's it. Yeah. The class timings, it's a 10 to 5. It's really good session. I was so panicked earlier. Thank you for the guidance. Thank you, doctor. Do I need to stay in the academy or can I travel daily from Liverpool? You can travel from Liverpool, but doctor, you know what happened? Traveling from Liverpool is going to create a lot of hassle here. You will feel tired. So I would say at least for those 12 days sessions, stay there. That is much better. That's my suggestion. What does the post-course session entail? This is the post-course support session, doctor. So, I mean, once you've attended the course, so you can attend these sessions as well and practice under the supervision of the instructor. That's the thing. Can attend the live classes regularly? Yes. What difference packages do you have and how much they cost? Okay, let me tell about the cost and the packages and all. I've got these FAQs as well. I'm going to come to it. And course booking, this one, and accommodation. So I just want to say those who are staying in our accommodation, they have got the access of practice area 24/7. I know some of you are studying in the night. You prefer studying in the night. Yes, you have 24/7 access, guys. Right. So these are our course booking infos, emails, and phone numbers, and these are for our accommodation. I'm going to send this to you, so don't worry about that. Now, our course price, how much is it? Our course is actually, Doctor, £649, which includes everything. It is live in person, live online, live telecast, recorded sessions, 2 mocks, and the notes and WhatsApp group post-course support sessions, anything, everything is included. That's 649. But if you are a group of 5, it is £100 discount, so it's going to be 549. If you are a PLABable subscriber, it is 549. If you are a group of 5 and PLABable subscriber, it is going to be 529 pounds. And how can I make this group? Just scan this QR code and come in the WhatsApp group. There you'll be able to find people as well who are also looking for making this group. So you will not have any trouble there. Right? So that's what you can do. Now, so that's the packages we have got. But if you want only some candidates, they don't want much of things. They just want academy practice. Some of them want they just the mock exam only. Just do one thing, guys. Just email us to info@aspire-to-plab.com or just leave a message on this number and our admin will be able to help. Or just come to the WhatsApp group through this scan code and our admins, they'll be able to help you out as well. So whosoever is there in the admin, you can just message them personally as well, and they'll be able to help you out. So just scan this code and come there, and we will be able to help you out. So, I mean, group of 5 or PLAB subscribe, you can get it in 549, guys. And yeah. What else? Can I come anytime after course to practice till my exam? Yes. What's the opening time? If you are staying in our accommodation, there is no opening time because it is 24/7. But if you are staying outside, it's going to be from 9 to 7, doctor. Right? Is there accommodation service? Yes, doctor. That's our accommodation team. You can talk to them as well. My exam is in March. When should I attend the classes? As soon as possible. Yeah. If you can't attend 12 days continuously, can we do it in parts? Yes. Where the academy is? Academy is in Blackpool, doctor. How much it costs for accommodation? It is, doctor, 20 to 25 pounds every night. So it depends what are you looking for. So if you check the website, you will have all the different options there. Can we attend as many in-person sessions? Yes. Currently, the applications are open until March. Do you know when they're going to open? April and May? I mean, I don't know, doctor. So I think once the March dates are gone, then I think they'll be opening that. The PDF book will be sent to you. Yes, so what happened when you subscribe, our system is like that. When you subscribe the course, you will have the access in your dashboard itself. We have got our application, our web application, the Study Genie. Through that, you will be having the access of the recorded course and the books and the flashcards. Yes, we have got the flashcards as well. I didn't tell you about that. So I'll show you what I'm talking about. So these are the flashcards we have made actually, flashcards. So what happened is every single topic we have covered through these flashcards. So they're going to be very helpful for the revision as well. you read the book, it feels like too much. My exam is in 2 weeks. What should I do? Revise with these flashcards, right? So very nicely it's made for every topic. So you'll have the access of these as well. So don't worry about that. So everything is covered, my friend. I mean, don't need to worry about anything. Can we attend 12 days in parts? Yes, 10 to 5. Yes. Can we get through the exam without a single person class? Yes. I mean, it's not a lot of candidates that pass this exam without any coaching as well. It's you, doctor. You know how much you know about this system, isn't it? With a lot of people, they're already working, they're already attending the attachment exam, so they might have a bit of idea, which is different, isn't it? Some of the candidates are already working in private setups, so they know a bit. So it depends. Some of the candidates already working in Ireland, for example. So system is kind of a bit similar. So for them, they can just directly go for the exam as well. So you need to see your situation, I would say. Yeah. And yeah, we have got some live on-spot offers as well. As I said, you are supposed to have a group of 5, then only you will be able to get in £549. But for today, as we're doing this session, if at checkout, if you put this coupon Aspire on spot flat 100, you will get £100 discount. You don't need any group of 5. You need nothing, and you'll be able to enroll for £549. It's only for 10 people. Only 10 coupons are there. So first 10 people can actually go through this coupon code as well. And rest of you can make a group, and we can help you out in making the group if you can just scan the QR code and come in the WhatsApp group, right? Yeah. Accommodation during the 12 days? Yes, you can book the accommodation, doctor, for the session. How far is the canyon from South Hall? South Hall is in London, doctor, but we are in Blackpool. Blackpool is near Manchester. Why you moved from Oldham to Blackpool? I live in Oldham. Doctor, I'm sorry. I mean, why we moved? The reason was we wanted to give you the access 24/7. So here it's in one building. So the classes are happening at the ground floor, and then upstairs you're staying. So in the one academy, I mean, one place. So I mean, you're just cooking there, you're studying there, sleeping there. It's kind of, you will live your hostel life again. That's what we wanted to give it to the candidates, right? So that was the reason actually we had to move. Do you have any recommendation? Do you any accommodation which your academy recommend? Yes, we do provide accommodation on our own. So we recommend our accommodation only, isn't it? So accommodation during the 12 days is, yeah, you can book it. So we have got the accommodation website, so you can book it through this website. Yeah. If my PLAB subscription has expired, can I still enjoy the discount? Yes. It doesn't mean your subscription is expired or it's not expired. You will still be having the discount. Or if you just apply this coupon first 10 people, you don't need anything. Yeah. With only PLAB, it's $549. Yes. But as I said, for first 10 people, I've already given this a flat discount. Yeah. With accommodation, how much will the cost for the full course? See, the course I have told you it's $649, but with this code it's $549, right? And the thing is, for accommodation, it's you, doctor, who's going to decide how many days accommodation you need. You need it for 12 days. Some people they stay for 1 month. Some people they stay for 2 months. So the accommodation is roughly 20 to 25 pounds every night. So you decide, and then it's gonna be accordingly. Is there a code for PLAB subscriber? The thing is, you just email doctor and we'll be able to help you out. And as I said, if you just apply this code, you don't need anything, right? And we will be able to send you the coupon. So if you are a PLAB subscriber, just email us, and with the subscribe, what do you say, any acknowledgement you have got from PLAB, and we'll be able to send you the code. Can we get group discounts on accommodation? Yes, of course. If you are a group, we can let us know. We can look into that. Yes. If live at Aspire accommodation without course enrollment, can I practice on mannequin? We don't allow anybody to stay in our accommodation without enrolling into our course, doctor, right? So that's not possible. Is there a package price if we get both course and accommodation? No, we don't have that package. So course is separate, accommodation is separate, doctor. Just to avoid the hassle and all, we have made it separate. In my opinion, you are the best option to prepare for PLAB 2. Thank you, thank you. And I'm probably saying yes, we are. Because tell me what others have, we don't have. There's nothing like that. And I can tell you what we have, which nobody else have. Our live 12-day session, nobody else have been in the market of PLAB 2, right? After course, if I want to stay on weekend, will I have to pay? Yes, doctor. If you are staying in our accommodation, you have to pay for it, right? You have to pay for it. Yeah. Parking, in this country, parking is a problem. There's a parking available outside the academy, but that's paid parking. Yeah, it's through NCP. You can get it. Is there a printed version of your notes? Yes, we'll give you the PDF. You can print it out if you wish to. Or I can go home late night. Can I stay till 11? So if you're not staying in our accommodation, just for the security purpose, the timing is 9 to 7, 9 a.m. till 7 p.m. Right? Is there any live sessions on Saturday, Sundays? Yes, 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 yes. I'm planning to book my exam in March. If anyone interested, practice together. Okay. Doctor, any chance we can get any demo class? Yes. So what we're going to do is how we teach in the academy. So what we're going to do, all of you, those who have booked it this session. So you will get a follow-up email as well from our side, the follow-up email. So on Tuesday, day after tomorrow, I'm teaching examination mannequins. We are going to give you the access of our whole class, the 12-day session, just one day. On Tuesday, on 23rd, we will give you the access. Okay. Attend that class, you will see what actually we do in the whole day. We don't just teach a couple of hours, we teach the whole day starting at 10 till 5 o'clock. We teach, we practice, we do everything. So yes, you will have a demo session as well you can attend. With PLAB subscription, it's $549. Yes, yes. And if you put this code, you don't need any subscription. You can just book it. Let me check if anybody has tried this coupon. Huh? I can check it. I think a few people, they're checking it. Okay. Yeah. And we're going to send this file in the WhatsApp group. So it is Aspire on spot flat 100. Yeah. And please scan this QR code. If you've got any question, we'll be able to help with those questions there as well. How can I use the discount and what is it for? So for our full course, from the website, you can book the course. Right. Let me see how can you get the discounts. Yeah. So so CJ, if you are listening, our admin, if you can just send the course link as well, the study genie, so they can just go and book it from there. Yeah. CJ, if you're listening, if you can just send that. Yep. So he's going to send in the WhatsApp group. So please come in the WhatsApp group. So it's going to be easy for us to communicate as well. Yeah. Is this course available for as long as we want or not just 12? Yes, it's not for 12 days. It's still you pass. So we have got the course dates and you can attend it more than once, twice, 3, 4, 5 times. That's absolutely fine. Can someone share the WhatsApp group link? It's there on the screen, doctor. The webinar was very helpful. Thank you. How far are you from Liverpool? Liverpool, I think it's 1.5 hour, doctor, if I'm not wrong. If you get the group discount and the price reduced to 549, yes. Can we attend the course in Istanbul? See, doctor, whenever we do the courses outside, in any country, so we have got other expenses to bear as well, isn't it? We have to have the space there. We have to travel with the mannequins. So no, the prices overseas, it is different, doctor. It is different. Yeah. So, what's the arrangement? Subscribe, online course, in-person course, practice, practice, practice. Absolutely. And give the mocks and attend our post-course support sessions. Yeah. How do I get the access? How do you get the access for all these things? If you just enroll into this www.thestudygenie.com. And I think our admin, yes, the CJ has already mentioned. If you see the WhatsApp group, yes. So if you see in the WhatsApp group, he has just mentioned he has given the WhatsApp link and the Study Genie link also. So you just have to go on our web application and you can book the full course. And if you're booking it now, you can just use this coupon code as well, Aspire on spot flat 100, and you don't need anything, and you just get the £100 discount straight away. Yeah. And when was the next seminar? So next is on in next 2 days. On Tuesday, you will have the access of our demo class, full class. Yeah. So yes, you can. Can I have the mock exam on the weekend? Say our mock exams are usually on Tuesday and Thursday, doctor. Tuesday and Thursday. But if you are interested in some personalized sessions, that we can arrange on weekends as well. So yeah, email us and we'll be able to help you out. Yeah. So please come in this WhatsApp group. Yeah. How do we gather the Plappable 5 group subscriber discount? So come in the WhatsApp group. First of all, just subscribe, just come to it. And if you're a group of 5 and all of you are Plappable subscriber, you will be able to get it in 529 as well. Yes, yes. And we can help you out. Just come in the WhatsApp group so we can have the group there. If you are Plappable subscriber and want to apply for the discount code, how much end up it being? So you can get the course in 529 pounds as well. Yes. Is there a minimum number of days criteria to book the accommodation? Yes, I mean, if you are booking, you have to book for at least a week, right? Otherwise, it's going to be too expensive for you. Yeah. Is there WhatsApp link, please? Yes, the link is there now, the QR code, if you can just scan it. Are the mannequins in good condition? And do you have enough mannequins for everyone to practice? Yes. See, doctor, we can't give a single mannequin. I mean, we can't give mannequins to every single candidate, right? For blood sampling, we have got 5 to 6 mannequins, right? So it's there in the practice area and you'll have enough of these. No problem at all. They are in good condition. Yes, they are in good condition. Sometimes, yes, wear and tear of the mannequin is going to happen. Yes. So no worries about that. So what you do, just tell the admin, okay, this is broken. Because like if you're doing speculum is broken, batteries for ophthalmoscope is not working. Just tell the admin and they'll be able to help you out. And they can change it as well. So no problem at all. Right. If we have a what is the group? That's done. What if we have a group of 15 plus? If you're a group of 15 plus, we'll see what we can do. If you're a group of 15, again, please reach out to us. Let us know, and then we'll see what best we can do for you. So maybe we can give you some more discounts. We'll see. Yeah, please reach out to us and come in the WhatsApp group and mention it to one of our admins, and we will be able to get back to you. Right? Can we attend 12 days in parts by following? Yes, yes, yes. Of course, you can. You can. There's no problem. You can attend it in parts. So when you attend it first time, you attend like say 5 classes. Next one, attend again 5 classes. You can definitely do that. Huh. Are the mock tests included in 12 day session? No, 12 day session. No. So, see, what we feel, there is no point of giving the mocks straight away after the course because after the course, you need to practice among your group as well. So, once you feel prepared, you will give the mocks before your exam, maybe 3 weeks before your exam, you're going to give the mocks. So, 12 days, not including the mocks. Mocks are separate, my friend. Yeah. Only we can attend 12 days classes, not more than that. No. So, in that 12 days, the session will finish. But if you want to attend it again, you can attend it again. You want to attend it third time, you can attend it third time. That's what we meant, doctor. Yeah. If I have Plappable subscription, do I still need a group of 5? No, you don't need. But if you are a group of 5 with Plappable, you will be able to get the course in 529 pounds only. That is the good point about that. Yeah. That is the main thing about it. Yeah. Okay. And yeah, if you put this coupon, you will be able to get the £100 discount straight away. Just try putting this coupon and you will be able to enjoy the discount. Right. And when is the closest demo session? So closest demo session is Dr. Day after tomorrow, right? So you have attended this session. So please wait for our follow-up email. It's going to come, I think, tomorrow. And it will have the link for the session that's going to happen on Tuesday. All right. So that is the demo session that you can attend. Because this was also a demo session, but I'm doing it from my home. But then how we do it from the academy, so you will be able to see through that. Yeah. Do we need active Plappable subscription? No, doctor. If you subscribe Plappable anytime, you don't need any active subscription. No active subscription required. Okay. So these are our contact details. This is a phone number. If you've got any doubt, you can actually mention it. Can you send the academy tour video that you promised? Yes. CJ, can you send a promo video? Right? We had that on YouTube. If you can send the link of that video in the WhatsApp group. Some candidates want to have a look, so they will see our classroom, our practice area, everything, mock room, so they will be able to see that. Yeah. So he's going to send guys in the WhatsApp groups, no problem. What's the time for the Tuesday's demo session? So it's going to be from 10 to 5, doctor. As I mentioned, our classes are 10 to 5. I know it's going to be tough. 10 to 5, not going to be easy. So stay tuned. Yeah. So 10 to 5, no problem. 10 to 5, yeah, on the Tuesday. What time? 10 to 5 UK timings, doctor. UK timings. Yeah, UK timings. Uh, 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 uh. Okay. All right. So yes, so somebody has just sent it. This is our the Academy tour. We just sent in the WhatsApp group. Yeah. Just have a look. And how many candidates will be there in in-person sessions? So it depends on doctor. I mean, batch to batch, I would say. Some batches we have got, say, 25, 30, 35. That's how it works, right? And what happens is some of the candidates, they attend few classes. So it can also happen like some classes you'll have more in-person candidate. For some session, it's a bit less. So for example, you have attended our live online, but when you come for in-person, you're like, you want to pick and choose. I want to attend only mannequin classes. So sometimes what happens in mannequin classes, the strength is a bit more. Some are like, no, I have attended mannequin. I want to attend counseling class only. So you will see like there are many people in counseling, but less in other classes. So it just keeps on changing because we are flexible. It's not like you have to attend all the classes. You decide you want to attend 1, 2, 3, 4, 12, how many you want. So it keeps on changing. Will we get a Zoom link for Tuesday demo class after this session? Yes, yes, doctor. We'll be sharing the Zoom link in the WhatsApp group as well. So if you come in the WhatsApp group, that's going to be easy for us. Easy for us to share the links and all. Please come in the group. Yeah. Is there any limit on in-person per batch? No, you can attend as many as batches you want. Do you know anyone who can help with the visa process and advise about the bank statement and money? It can help to decide which month I can book the PLAB to. Yeah, what we can do is we can put you in contact with some people, those who help in the visa. From our side, if you book our course, we can give you a course letter. We can help you out. We can help you in writing your what do you say, the letter. So the course letter, the accommodation letter, that we can give it to you. These two things we can provide, that you're going to come here to attend the courses and all. And if you need some agent, we can suggest some as well. So if you email us and if you come in the WhatsApp group, we can help you out with that as well. After a group of 5 is gathered, what is the next step to do? You just email us or just message. If you're in the WhatsApp group, just message one of the admin and they will be able to send the coupon code to your email address. Guys, be very careful because lots of scams are also happening. So any booking that you will be doing, it has to be done on our website only, thestudygenie.com, and the coupon code you will be getting through the email, and our email is info@aspirePLAB.com, right? So don't worry. So it's going to be like that. So if you're a group of 5, you can message one of the admin as well, and they will be able to help you out. Or what you do, all the 5 email addresses, just email to info@aspirePLAB.com, right? And we'll be able to send you the discount coupons and the link where you can put this coupon code. This is how it works. How many instructors are there total in Aspire? There are so many. In terms of teaching, I would say it's I and Nikhil, we both take most of the classes, right? We have got other instructors as well, those who take the mocks and other sessions. There are more than, I would say, 10, more than 15, I would say, instructors we have got. But the main classes, the 12-day session, are usually taken, most of the classes taken by me and Dr. Nikhil. Okay. I was an average student during my med school days. Can I pass PLAB 2 in 75 days? Yes. 75 days, meaning 2.5 months. Yes, yes, yes. Of course, yes. 2.5 months should be enough, doctor. Right. And this exam is not for intelligent doctors. I always say this line in my class. This is not for intelligent doctors. This is for smart doctors. And all the doctors are smart. So don't worry. Okay. Yes. How to join the WhatsApp group? So the link is there, doctor. This is a QR code if you can scan it. And also the email that you must have gotten from our side when you book this, the link through which you're attending this session. So you can just find the WhatsApp link there as well, or it's there in the on your screen. I have prepared for AMC clinical, but did not appear in the exam. Is PLAB to prep the same like that? Not almost same, but it is gonna have, it's gonna give you an added advantage, obviously. So definitely helpful, definitely helpful. But every exam is different. Marking criteria are gonna be different. But definitely whatever you have done for AMC is quite helpful. Yes. What about those doctors who are just hardworking, not smart enough? It's hard. We'll make you smart. Come on, we'll tell you. We'll tell you. See, what I mean by smart. Uh, Sometimes what happens is you have got too many things and you want to say everything to the patient in the exam, which is not going to happen because you don't have that much of time, isn't it? So what to do? What to do? So why I say smart doctors? So instead of telling everything, which is not possible, ask the patient what you want to know, isn't it? So that is what I call a smart doctor. Smart doctor will not tell everything to the patient. Smart doctor will ask the patient, what do you want to know? And then only tell that thing. That is most important. That is what I mean by a smart doctor. Another thing, so you went into the cubicle and it's a BLS teaching station, and you're like, oh God, it's been long. I've not done BLS. How can I teach? What should I do? So what happened is, when you enter into the cubicle, those are smart doctors. What they do, they have to teach BLS to a medical student. So they just look around. Oh, there's a chart on the wall. Okay, so Alex, how to do BLS? Let's have a look. Let's see on the chart. So this is the BLS resuscitation charts. This is the first step, second step, third step, fourth step. Got it? Let me demonstrate for you on the dummy. So what I did, I just was a smart doctor. I just checked what they have given it to me in the cubicle, and I just showed that I'm a confident doctor. So that is what you need to do. And all these things are going to be done in our classes. Don't worry. We'll be teaching you all these tips and tricks, small things that is going to be quite helpful for you in the cubicle when you go there. And we'll put you through that journey as well. What I mean by that, so how things gonna go. So that is how we're gonna practice with you guys in the academy as well during the session. So for example, you have got a Simban station, right? So we do the Simban teaching, and after that, we'll call you on the stage. Simban is there, and we'll give you a scenario, and we will be doing it the way it's going to happen with you in the exam. So you will live this journey, the journey that you're going to have in the exam, you will live the journey here in the class. So when it's going to come in the exam, it's going to be a piece of cake for you. That's how we can prepare, right? If I'm thinking to give in Feb, when to join the academy. So again, Dr. My answer will be as soon as possible. So we don't need to delay that. Okay, let me answer these. There are some FAQs that we have got. How early should I book the PLAB 2 course after passing PLAB 1? I would say as soon as possible, because you book it now, you book it after 2 months, your subscription is going to be till your pass. So why to delay? So start as soon as possible. Instead of like last 2 months, then you have to just read every time, just practice every time. Now you can start slowly. Now, if your exam is in Feb, you can just start from like 1 hour, 2 hours, you can give it to PLAB 2, but start from today, right? My English is not so good. Will fluency in the grammar matter? Ah, come on, doctor. Have you not passed your OET or IELTS? Yes. So come on. And I can tell you your English is much better than the Britishers, right? Britishers, they don't know grammar. They just talk because they know it's their language, but they don't even know the grammar. So don't worry. Don't worry. And also when you start preparing, you'll be talking in English only for 2 months, 3 months. So you will see the things will improve. And please trust your language skills. And as I said, just use small sentences. Why you need to say complex sentences? Your English is absolutely okay. Trust you yourself, trust your language skills. Can I join the course while waiting for my PLAB 2 exam date? Why not? Because you may, if you feel, okay, I'm prepared now. So if you prepared, then maybe you can get any date you get, isn't it? Because a lot of people, they cancel the exam dates as well. So I would say prepare. And when you're fully prepared, then maybe you can get the early exam dates as well. What documents are required to enroll into the course? Nothing usually, just the passport we need later. You will be able to upload that in the system itself. Can I attend just the mocks without joining the full course? Yes, of course. How long does it take to complete all the course material? So what happened is, it is like you're attending our course as well. So we don't want you to read all 1,000, 1,500 pages in one go. So whatever classes you're attending, just read the relevant material. So, I mean, I think within 15, 20 days, it can be easily done. Is the mock exam format similar to the real exam? Yes, yes. Are there separate batches for morning and evening? No, it's just the one at 10 to 5. So that's how it is, right? How do I access the downloaded books and the resources? So when you enroll into the course, in the dashboard, everything will be shown. So from there, you can download the PDFs for the books. And as I said, you can also download the flashcards as well. Nobody's having flashcard. Come on, we're giving you the flashcards as well, right? The price does not cover the mock exam. It covers 2 mock exams. So what it covers, let me show you. So it covers all these things, guys. It covers all these things. So your in-person classes, your online live classes, your pre-recorded classes, your materials, your mocks. 2 mocks are included, my friend. 2 mocks are included. Yeah. So yes. What are the more FAQs? Are the online session live or pre-recorded? Online sessions are live. That's why we have got the dates announced already. Yes. How much the mock cost? It is included in the course, doctor. 2 mocks are included, but if you're booking an extra mock, you will be paying £60 extra. And if you're booking only mocks, it's £75. So 2 mocks are included. How do I get feedback on my performances? Okay, so how do you get the feedback on your performance? So what happened is we give two kinds of feedback. So soon after the mock finishes, you'll get the in-person feedback from all the mock examiners. And then the next day, you will be getting a PDF of all proper examiners, whatever they felt like. So it will be in written all for all 16 stations properly, right? Can I request a one-to-one session with a tutor? Yes, you can, and we can help you in booking that as well. What's the difference between the Aspire Notes course material with the Pluggable Gems? I understand these two companies are partners. Yes, we are the partners, and the Pluggable Gems, it's different, and they have started doing these gems, but the gems are like not all of it. It's a bit of it, like only 100 stations and all they have got, but we have got the full of it because mainly Pluggable, they deal with PLAB 1 and Pluggable Aspire, we deal with PLAB 2, right? So that's how it is. So I would say, I mean, they are expert of PLAB 1, they are expert of PLAB 2. That's how I can put it in words, right? We are friends, Z and I, we are very good friends. Yeah. What happens if I miss multiple sessions due to illness or travel? Attend it again, no problem, no problem at all. How often are the new batches started? So, in a month, roughly 2 batches we have got. Can I practice with the study partners at the academy? Yes, yes, yes. You'll find 100, you'll find 50s of practice partners, so no problem at all. Is there a recommended schedule to follow for self-study? Please don't do self-study. I don't recommend self-study for this exam. For PLAB 1, yes, self-study, that is what you guys do. But for PLAB 2, mingle with people, talk with people, practice with people. Don't stay in your room and do self-study. Do you offer crash course or last minute preparation? I mean, this exam is not like just a joke crash course. No, it's not like that. It doesn't work like that. You have to prepare fully. Come on. You have given too much of your things to this exam. The exam is expensive. The travel is expensive. The accommodation is expensive. Why can't you just prepare properly? Why just believing in those crash courses? It doesn't help. When you're not giving 100% to this exam, how can you expect 100% results from them, right? Please give your 100%, right? That's the thing. But yes, for the revision purposes, our flashcards are there. That's one. Plus, any new things coming in the exam, so you will see we will be doing the webinars on the new scenarios as well, right? Is there a separate fee for the mock? No. Do I need to complete the entire course before attending the mocks? I mean, that is recommended. That's recommended, isn't it? Because if you do that, then only you will be able to enjoy the session, isn't it? I mean, the mocks. Otherwise, it's gonna be a problem. Yeah. So better is that. Can you pass with not a good management? See, it's not gonna work, isn't it? So why wanna take the risks? Management is 4 marks, 4 marks. So, and if you give the wrong management, don't think it's not gonna affect my data gathering and IPS. It's gonna affect all of them, right? So management is easy. Management is on addressing the patient's concern. It's not that difficult. Just have enough time for the management. Can you pass with not a good management? Yes, but it's risky. It's risky. Why you want to take that risk? When you have got 3 domains, we can definitely work on all 3 domains. Yeah. What type of visa do I need to attend the in-person course? You can come on a student visa. Sorry, this tourist visa. That's absolutely fine. On tourist visa, you can attend the course. On tourist visa, you can give the exam. No problem at all. Can I get support with the booking my PLAB to test date? Yes, yes. I mean, any support you need from our side, we'll be more than happy. So just email us. We can help you out. And we have given our WhatsApp number. You can just, this is our Academy's WhatsApp number. That's our email address, info@aspireplab.com. Or any doubt if you've got, just scan and come in the WhatsApp group. And we are there. We are there. All of us, we are there in the WhatsApp group, and we will be able to help you with your queries. All right. Okay, so that is it from my side. Is there any other question that you guys have got? Tell me, there's still 80 people out there online. Uh-huh. I said I'll take, I mean, roughly 1.5 hours, but I think I have taken a bit longer now, roughly 2 hours here. I hope you enjoyed. Do you offer research support or recommendation? I'm really interested in that kind of experience, especially since I haven't had a chance. So how I get if I'm already graduated. See, research and all not really, but we can help you out with something that is, what do you say? This teaching experience, because in whenever you apply for the training and all, if you have done any teaching, that has got good marks and all. So that is something that we can help you out with. Our course, we are the only academy, our course is CPD approved as well. And that is very important as well, because once when you start working, you need 50 CPD points every year for your revalidation as well. So you're happy to know that our course is CPD approved as well. So these things you can put in your CV. That's going to be quite helpful for you guys, right? I'm debating between Jan 28 booking or March 3rd. Any guidance? See, if you're booking Jan 28, that's absolutely fine as well, because you'll have enough time. You have got October, November, December, and Jan. 4 months are enough. But so that's fine, doctor. You can go 28th of Jan. So that is absolutely fine. I mean, and it depends. I mean, how much time, if you're able to travel that time, that's okay. So 28th is absolutely okay. Can take more 20 to 25 minutes with FAQs. Yeah, I'm here. Just answer any question that you have got. Just ask me, and I'll be happy to answer your questions. People are engaged in messaging for me. Yes. During the enrollment, do we have to? Just a sec. Let me just stop the recording of the session.